Welcome to the Allen's Training Workbook video series. This video is a brief outline of Topic 1, First Aid, Roles and Responsibilities. For further information and diagrams, please review the corresponding PDF document available on our website. First aid is the initial care provided to someone who has suddenly fallen ill or who has been injured, until more advanced care is provided or the person recovers. Immediate and effective first aid may reduce the severity of the injury or illness and promote recovery. Knowledge of first aid is important for everyday life, at home, work or in the community. The Australian Resuscitation Council is a voluntary coordinating body that creates uniformity and standardisation for resuscitation techniques and the provision of first aid. They develop guidelines for the provision of CPR and first aid. If you are trained in first aid, it is imperative that you maintain currency of skills and knowledge. Routinely attend refresher courses and be aware of changes to legislation, policies and procedures, and the ARC guidelines in relation to first aid. Ethics and first aid. If a first aider decides to provide assistance to a person in need, they must provide a standard of care appropriate to their training or lack of training and never go beyond their own skills and limitations. They must act in good faith and without recklessness and with reasonable care and skill. First aid must be provided in accordance with first aid principles, making the casualty as comfortable as possible using available resources and equipment. A good Samaritan is defined in legislation as a person acting without expecting financial or other reward for providing assistance. First aiders should not fear litigation if they come to the aid of a fellow human in need, as long as they do not act recklessly and try to avoid further harm. Ethical issues are dependent on law, cultural beliefs and principles, and on moral grounds. Simple ethics include always displaying respectful behaviour towards the casualty, maintaining respect for their beliefs, privacy and dignity, and paying careful attention to consent and confidentiality. Personal information about the health of a casualty must be kept confidential and should only be accessed by authorised people. Information includes details of medical conditions, treatment provided, and the results of tests. Disclosure of personal information without that person's written consent is unethical and in some cases may be illegal. The consent of an injured or ill person must be obtained before assistance is rendered, regardless of age, ability, health or mental status, unless the casualty is unconscious. If the casualty is a minor, consent must come from a parent or guardian if available. The casualty should be made as comfortable as physically possible by using available resources and equipment. This might mean placing a pillow under broken limbs or behind a head or back, covering them to keep them warm, or providing pain relief using hot or cold packs, etc. The casualty will feel better knowing that you are going to stay with them and care for them until further help arrives. A first aider should monitor the casualty and respond to changes to their condition in accordance with first aid principles.